before I start, I have to give what is my pathway today. It's actually 15 minutes is not a time to talk about pain, but just to emphasize on what is holistic approach and what is the nurse's role in that practice. So before that, I have to give a small awareness, or you are already know these things, but I have to just remind you again what is pain and what is holistic approach and what is the nurse's role. So what is pain? I think we all have experienced pain in our life, maybe mild or moderate, sometimes severe pain. Sometimes we have experienced our family members, how they have suffered during their illness, sometimes for a long durations, maybe a cancer or a chronic pain condition. So we have experienced as human beings how the people suffer from pain. So we all know, according to the International Association for Study of Pain, defined the same components as it is an unpleasant sensory as well as emotional experience, right? It is associated with actual or potential tissue damage or described in terms of such damage. So there are several components, sensory and emotional. So sometimes we forget this emotional component. So that is included in the definition because it has a big impact on pain. What is holistic approach? It is the total pain assessment, or that defined as holistic pain management is an approach that takes into account the emotional, mental, spiritual needs of the individual in addition to the person's physical state. So in holistic or the total pain assessment, or if you take the whole person, we have to consider the emotional or the mental state and the spiritual needs of the patient. So if you think what is the nurse's role in that case, I think the biggest part in this management or the pain management can be done by the nursing officers, because nursing officer is the bridge between the patient and the medical officer. You are the person always goes to the patient and talk to the patient, and patients are more closer to the nurses rather than the doctors, because the time they are getting to talk with nurses are much more, and nurses are always in the ward during the daytime or night time. So they are more closer to the nurses. Therefore, they are more tend to talk to the patient and express their ideas. So the nurse is the biggest listener in the ward. So they have the bigger part when compared to the medical officer, who has less time to spend for a patient in the ward. So in that case, you have to have a wide idea, or you have to understand the component of holistic pain approach in the management. So if you are asked just assess pain, we have several components. I use the mnemonic Socrates, not only me, I think you may know this. Socrates is the mnemonic we are using to assess pain of any patient. Site, onset, character, radiation, associated symptoms, duration for how long you are suffering this pain, exacerbating factors, and severity. So these are the basic components when we are assessing a pain patient. Why I am stressing on assessment? Because the management all depends on the good assessment. So the main part of the pain management is the pain assessment, which can be done by anybody. No need to be a medical officer. Anybody can do. So it is a very important aspect as a nursing officer should know these things, and it is easy to remember as Socrates. So there are many mnemonics, but I feel this is much more easier. So site, onset, character is what type of pain you are, dull ache or aching type, dull, numbness, tingling, these types of different characters differentiate different types of pain. So as it is not the time to talk in detail, I'm just going through what it is. Because nociceptive pains, you feel it as a sharp or dull pain, and neuropathic pain, which is involving the nerves, and usually it is due to nerve damage or tissue damage sometimes, affecting the nerve conduction. So in this case, the patient will feel numbness, tingling, electric shock-like. So these are very important when we are deciding on drugs. So though you are not going to decide on drugs, but identifying these things are important as nursing officers. So if the patient complaining numbness or different feeling, warm or something, so it is important to document and let the medical officer know that. And radiation, associated symptoms, nausea, vomiting, in acute myocardial infarction or acute appendicitis or some acute inflammatory conditions, why we are very much rely on these associated symptoms as well. So they are very important to identify as a nursing officer. Sometimes patient may be diabetic, he may not feel pain, but he will start vomiting, sweating. Those associated symptoms sometimes life-saving. And duration, it is important, especially in chronic pain conditions. But anyway, duration sometimes will help to give the diagnosis as well. And exacerbating factors and severity is very important to decide on treatment. So severity, just saying mild, moderate, severe, it is important to say in a scale, because it is more objective rather than subjective. So you have seen pain scales, I think you are all familiar now, rather than just giving rude value like mild, moderate, severe, like a number, 0, no pain, and 10 is the worst pain, like untreated labor pain or myocardial infarction pain is number 10, and 1, 2, 3 is something very much mild, which is you can do your daily work, even you are having pain. Moderate is the pain that it is disturbing your daily activities, and 7, 8, 9 pain is patient is screaming or crying in pain. So these are very important to observe as nursing officers and ask as well. So what is holistic approach? As I said, that is your emotional, spiritual, social, and psychological components, because the patient's pain is modified by those factors, especially the emotional things. So depression and pain going hand in hand. So you have to identify those things. So you have to ask in detail the family problems, social problems, any other previous illnesses, and sometimes, especially like cancer pain, the patient's emotional and spiritual aspects. Sometimes they lose faith on their religion. Sometimes they think that I'm such a good person, why did I get this? So those things are hidden inside unless you talk to the patient. And it is important to really reveal them as well. So management, in the management, the pharmacological management, which is nurses are not much involving, where the doctors decide, but your assessment is very helpful for the management. So yeah, we use the guide WHO analgesic ladder, but still the nurses has a big role in that as well, to decide when the patient was prescribed PRN doses, to decide whether you have to give it or not is decided by the nurse. So if the patient says hurts, that is pain. So we have no right to say that you cannot have this much of pain, or you even after surgery, it is normal to have pain. In labor, it is normal to have pain. No, we don't have right. So therefore, we have to give the PRN doses if prescribed if the patient says hurts. Then that's why I said in pharmacological management, even the doctor prescribed, the nurses has a big role in that aspect. And non-pharmacologically, I think there's the main role is done by the nursing officers. Sometimes maybe massaging techniques, sometimes education, reassurance, and to get reassessment of the patient. Those things are done by the nursing officers. And physiotherapy, I think you know basically those things, massaging techniques, heat and cold fermentations, those things you are taught in your nursing school, so they can be applied in any ward. So if you don't have anything, there's one big thing that you can do, as I think the previous two speakers extensively talked about that regarding the empathy and the compassion. So the way you are talking to the patient, your body language will heal the half of the pain, right? So imagine you are in pain and somebody scold you, how you feel, you start crying, right? So always put yourself in that position. If I'm having this pain, if my child is having this pain, if my mother, my colleague, or my relation is having this pain, if he or she was scolded by a staff member, how do they feel? And the same to the patient as well. So empathy and compassion is the main two components in pain management as well. The emotional part is sometimes more than the sensory component. So therefore, the nursing officers and all the medical staff, even our supportive staff, doctors, everybody has the opportunity to treat the emotional component, not only the psychiatrist. We all have the responsibility and the ability to treat the sensory and the emotional component of pain, which is very, very powerful. So as the holistic pain management, it is very great that if you can talk very softly, touch, the therapeutic touch and all the things I think you are taught in the nursing school. So those things you can practice every day. Your smile. It's true that we also have problems. Sometimes we work with crying. Maybe we having some illness, maybe some psychological, maybe some family problem, but it is irrelevant after coming to work. So therefore, it is very important to hide all the things and give the best care to the patient. So I think, though we don't have even a paracetamol, it might helpful to relieve half of the pain. So therefore, I think you all know these things, and I think the aim of this lecture or this symposium is to highlight those things and bring up them to day-to-day practice. So I think all of you will use your current knowledge and your skills and your attitudes to change the world as nurses and the medical officers as well. So I think I'm running out of time now. So it is my take-home message is show empathy always, and you should not emotionally involved as well, because sometimes, especially in cancer hospitals, places like that, sometimes we tend to emotionally involve. You should not do that, but you have to show your empathy always. I think my lecture will benefit for some extent to uplift your day-to-day practice. Thank you.